As many Nigerians are well aware, medical inflation has become a pressing issue impacting the affordability and accessibility of healthcare services across the country. Our Rise correspondent, Laila Johnson-Salami, has been exploring the factors contributing to this rise in costs, from economic challenges to supply chain disruptions, and hearing from experts and citizens alike about their experiences. She sent in this report.
In the past few weeks or months, we've had escalating numbers of patients coming in hypertensive urgencies. So they come in with very high blood pressures, some as high as 250, 120, yes. And a lot of times when you drill down, you'll see that part of the problem is accessibility to drugs. They can't afford their drugs.
Nigeria is experiencing a severe economic crisis. A deteriorating foreign exchange situation has led to a sharp increase in drug prices, making essential medications unaffordable for many.
I remember writing a prescription for a child, and the mother called me from the pharmacy and said, "Doctor, this drug you prescribed for me, have you bought it?" I said, "I don't understand." She said, "Have you priced it recently?" I said, "No, I haven't." She said, "It's 60,000 naira. I can't buy it."
Dr. Okore is impacted not only as a medical professional striving to provide the best care for her patients, but also as a mother who has personally experienced the dangers posed by the steep rise in drug prices.
December last year, my daughter caught a bug that was multi-drug resistant. Assuming I didn't have people to support me and this thing happened to me, I would have lost my child.
Pharmacist Hamed Lasisi expresses grave concern over the sharp rise in the cost of medication, noting the dramatic difference when compared to prices just 2 years ago.
And now there are patients that you just don't see again, and by the time you get the information, it's that they are not adhering to their medication again. So you're giving someone a medication for a month, the person stays out and starts using one every other day, something they're meant to use every day.
This pharmacy provided us with data comparing the price of medication stocked in 2022 to current prices. Augmentin, a broad-spectrum antibiotic, increased from 8,800 naira in 2022 to 15,400 naira this year in 2024. Exforge 5160, used to treat hypertension, has risen from 12,500 naira in 2022 to 38,500 naira today. And Zoladex, used in the treatment of breast and prostate cancer, has escalated from 50,500 naira in 2022 to 194,000 naira today. According to research, Nigeria has one of the highest rates of asthma in Africa. And in July of this year, Saidat Mohammed faced a harrowing experience when her 12-year-old son suffered a severe asthma attack that put his life at serious risk. As the cost of medication continues to rise, managing her son's condition has become increasingly challenging.
It was around 5,000-6,000 naira, and then it graduated to about 13,000 naira. As at the last time we went to the hospital, to the pharmacy, wanted to get this, it was 95,000 naira, so I walked away.
In 2023, British biopharma company GlaxoSmithKline, a major manufacturer of Seretide, which is essential for many asthma patients, transitioned to a third-party distribution model in the Nigerian market after over 5 decades. This shift has significantly impacted disease management, leading to skyrocketing prices for GSK products and diminished supply. According to the company, the foreign exchange crisis made it untenable to continue operations in Nigeria under a direct model. In a statement to Arise, GSK explained that they could no longer ensure consistent supply of medication and vaccines. For other illnesses such as diabetes, endocrinologist Dr. Pauline Nwaokwa notes that many of her patients can no longer afford insulin.
Sometimes don't see patients. You don't know why. It's just a few thousand, be someone you call, "Doctor, I don't have money."
Most medications, including generics, have seen price increases due to the country's economic crisis, where demand has outstripped supply.
The end result is likely going to be utter mortality and morbidity for these patients.
Adding another layer to this issue is the state of health insurance coverage in Nigeria. Currently, health insurance penetration is low, leaving many individuals without coverage to help offset medication costs. Even among those with insurance, coverage can be limited or insufficient to cover all necessary treatments. For additional insight, I spoke with the country manager of Reliance Health, an insurance provider.
PwC Medical Research Institute has projected an 8% increase in medical cost trend in 2025. And this is largely driven by inflationary pressure on our economy in Nigeria. Truth be told, these healthcare providers, they have to be profitable. You know, HMOs also have to be profitable. And each time there's an increase in drugs, they have to increase their tariffs.
The high cost of medication presents not only a financial burden, but also a significant public health issue. Advocacy for policy changes and increased support for local pharmaceutical manufacturing are crucial in addressing these challenges. Most importantly, strengthening Nigeria's economy is essential. In the meantime, many Nigerians continue to face a daily struggle to afford the essential medications vital for their survival. Laila Johnson-Salami, Arise News, Lagos.
All right, great reporting as always, and we are happy to have Laila Johnson-Salami with us in the studio. Laila, good morning to you. Hey, look, as always, just excellent work. What pushed you to put this through? Was it from talking to folks? What was the inspiration behind getting this together?
Everywhere you go, you see people literally dropping like flies right now, and you wonder why. And the honest truth is, people can't afford their medication. We look at food inflation so much. We look at inflationary pressures when it comes to so many other factors. But healthcare, keeping people alive so they can go to work, so they can provide for their families. I feel as though that's an area we have not touched on that much, and it's become far more significant in the past year, especially due to changes that have happened. Companies like GlaxoSmithKline having to change to a third-party model after over 5 decades in Nigeria, just to continue being able to provide to this market. And it's interesting because once GSK in August 2023, changed to a third-party model, a lot of the reporting around it was, oh, GSK have pulled out of Nigeria, which is not true. GSK have not pulled out of Nigeria. They are still here, but they had to change their model because the Forex crisis just made it untenable for them to stay here and continue operating here as they were. Now, speaking to GSK about this issue, what they've said is that in Q1 and Q2 this year, they've made changes due to bringing on more suppliers. They're still trying to bring on more suppliers in Nigeria, and they said that soon we should be seeing costs going down. And you can see that reflected in some medications like Augmentin, for example. It was higher in 2023 than it is right now. It has gone down a bit, but for some other medications, we're still seeing that the price is so high. And it gets worrying when you're looking at chronic illnesses like asthma, chronic illnesses like hypertension, like diabetes, where patients have to take their medication to survive, you know, or illnesses like HIV as well, you know. GSK are the producers of Dovato, which was one of the most used HIV antiretrovirals here in Nigeria. And there are worries that are we going to see an increase in HIV transmission rates because people can't access their HIV drugs as they could before. So these are all of the questions that we need to ask, because if you don't take your HIV medication, then of course your viral load does increase. So it's a significant public health issue, and there have to be policy changes to address this because HMOs have to be profitable. Healthcare providers have to be profitable. So we have to ask what policy changes the government can drive in and bring in to support healthcare providers, to support HMOs, and to support Nigerians who need their help accessing medication right now, because even generics, Rotas, that are cheaper than these big brand names that we know, from your Pfizers to your GSK meds, even generics have gone up in price, and a lot of people cannot afford to buy these medications anymore.
Wow, and it's so touching. I mean, you talk to everybody. You talk to the business side. You talk to doctors. You talk to mothers trying to, take care of their children. The matter of insurance, Laila. I heard you saying the HMOs have to make money. I don't know. I'm throwing it to you as to what the solution is. I think we have to have a robust universal health insurance scheme. I know the money has to come behind it that can allow people to bridge that gap. How do you think that we can cross that bridge?
That comes down again to the government, or it comes down to public-private partnerships. Take a country like India. There's a brilliant healthcare scheme in India called the Narayana Healthcare Scheme, and what they've done is they've been able to make health insurance affordable to all. And it's quite technical, but they've gone about it in a way that works. So the poorest of poor in communities and the richest of rich can all get the same standard of healthcare under this health insurance scheme. And we have to start looking at innovative ways in which we can do that here in Nigeria, because first of all, not enough people have health insurance to begin with. And then secondly, if medication is costing a certain amount of money, there's only so low that healthcare providers and HMOs can sell that medication off to their patients at without becoming broke themselves and not being able to function and run anymore. And government has to understand this. It's not about, try bring the costs down because these people need these medications. If you do that, then how are you going to pay your staff and how are you going to keep that business up and running? So it's a serious issue that's going on right now. And to add to that, that lady I spoke to, the mother of the asthma patients, she was telling me that what she has to do now to get Seretide, and for our viewers, Seretide is it's the purple inhaler. It's the one with steroids in it that a lot of people with serious asthma have to use every day. She is now having to bring it in from Egypt to be able to ensure that her son has supply. And I know other asthma patients I've spoken to that are also now getting their Seretide from Egypt because it's cheaper in Egypt than it is here. Imagine walking into a pharmacy here, trying to get something you need daily and having to turn to a country like Egypt to get that because you cannot get it at an affordable rate here in Nigeria. So the end result is people are just going to continue getting sicker. Hospitals are going to be completely overwhelmed and short-staffed, and we already have an issue of a lot of doctors and healthcare providers leaving the country anyway. Yep. So it's very worrying, and if things don't change, I don't know what this is going to be looking like next year with PwC telling us that what we're going to be expecting even next year is going to be worse than now.
There was a lot of talk about foreign exchange, and I know a lot of this is important. What about the issue of making most of this stuff homegrown, manufacturing them here so we don't have to import?
Now, that's one thing we do have to start doing. We have to start manufacturing more in Nigeria. However, Rotus, at the same time, a lot of the things that are used to manufacture here in Nigeria still have to come from abroad, So right now it looks like there's no win-win situation to this unless we have policy changes, that we have the government stepping in and saying, we have to do something in this sector because we have to keep people healthy and alive. The economy is sending a lot of people into hypertension anyway, and then you become hypertensive and you can't afford your medications.
Laila Johnson-Salami, our ICE correspondent, excellent work. Thank you so much for that report. Thanks for coming on to talk about it.